Hi, this is Dr. Curt Waller for the Advanced Organic Acids Test Mastery course. This is a short lecture on advanced topics in organic acids test assessment. Title is Folate, Pyrimidine, and Methylation. So the Advanced OAT Mastery course is a comprehensive course that goes through every marker on the organic acids test from Great Plains Laboratory. Now, taking this course, you'll come away and feel confident in interpreting other organic acids tests from other companies as well. And so part of this course is not only go through each marker, but how to clinically correlate it, as well as the different sections on the organic acid test, how they relate to one another. So let's talk a little bit about the folate, pyrimidines, and methylation. The pyrimidine metabolites is linked to folate metabolism. Now on the OAT test, there's two markers, uracil and thymine. When you see an elevation in the section, it's usually uracil that's elevated. Thymine is sometimes high. When they're both high, it's definitely significant. Remember, folate is linked to methylation, and imbalances in folate and methylation can affect the brain and nervous system. People can be depressed or anxious or have sleep problems, concentration and focusing issues as well. Also, certain genetic diseases, deficiencies in folate, conversion problems in folate metabolism can be indicated because of elevated pyrimidines. So where these words come from, purines and pyrimidines, these are nucleic acids that make up our DNA and RNA. And the pyrimidines are one carbon nitrogen ring, whereas the purines have two carbon nitrogen rings. It's not like you have to remember that. But what's worth knowing is that when you're looking at uracil and thymine, thymine comes from DNA. So imbalances in thymine are indicating some type of problem in the DNA. And then uracil elevations indicate some kind of problem in the RNA. And likely one of the reasons that uracil often shows up elevated more commonly than thymine is that there's more activity of RNA in its biochemical relationship to protein development. So the flow of genetic information is we go from DNA synthesis, and then we get DNA duplication, where it's then transcribed by the RNA, and then we produce proteins. So a lot of activity in the area of RNA. Also, there's an expanded role between folate metabolism and the influence it has at the DNA level. It supports other chemicals like ATP, for example, that energy currency for mitochondria. But it has a relationship too to methylation, and methylation even has a role towards dopamine regulation, specifically in this particular slide, a dopamine receptor that affects attention. So dopamine 4 receptor polymorphisms can influence attention. They've been linked to other mental health disorders like schizophrenia, eating disorders, and even bipolar. We know that there's the methylation cycle. There's the folate biopterin cycle, and all of these have a relationship to each other. They're very important in supporting neurochemical levels in the body, dopamine, norepinephrine, serotonin, as well as supporting glutathione levels for detoxification. So on the organic acid test, there's a couple markers in the indicators of detoxification section that can indicate glutathione deficiency. Now, pyroglutamic is linked to the status of glutathione, and when it's elevated, it indicates that there is a glutathione deficiency. There's another chemical here called 2-hydroxybutyric, and when it's high, it's a little bit more complicated as to why it's elevated. 2-hydroxybutyric can be elevated most commonly because the body is attempting to maintain normal glutathione levels. And then you have to ask the question, well, why is that happening? Well, Glutathione is a very important chemical as an antioxidant. It protects our cells, protects our mitochondria. So the body's working overtime to maintain normal glutathione levels. The system's being stressed because of some type of toxin, bacterial toxin, yeast toxin, mold, chemicals, heavy metals. There can also be other imbalances in the methylation cycle and other genetic factors that could lead to increases in 2-hydroxybutyric. And in the advanced OAT mastery course, we'll go through these other variables. Methylation and transsulfuration. Remember, methylation is where we convert homocysteine to methionine. There's two ways that happens. There's through the action of the methionine synthase enzyme, and then we get trimethylglycine or betaine being converted to dimethylglycine. So if we drew a line, above that line is methylation. Here's our folate cycle. Below this line is transsulfuration. The body attempts to maintain glutathione levels against some type of toxic stress. And so if there's increased demand for glutathione and we're starting to pull homocysteine into this pathway, we'll start to see an increase in the reactions of this pathway, which are the 2-hydroxybutyric. Now, there's many reasons that glutathione can be deficient. Heavy metals, mycotoxins, nutritional deficiencies, inflammation, Clostridia bacteria, etc. And so it's not uncommon on the organic acid test to see an increase in 2-hydroxybutyric because the body is working hard to maintain glutathione levels. It's part of that pathway. So I'm Dr. Curt Waller. I've been an integrative and functional medicine physician for over 20 years, working as a clinical educator for Great Plains Laboratory for a number of years, as well as the co-founder of Integrative Medicine Academy, which is an online training academy providing courses for healthcare practitioners in various topics related to integrative and functional medicine. I've worked with autism for many years, patients with autoimmune disorders, gastrointestinal, as well as neurological diseases. And one of the running themes of our mastery courses through Integrative Medicine Academy, including the advanced OAT mastery course, is think critically, think clinically. And that's how to apply the information that you learn in our courses to your practice, as well as the labs that you're analyzing, not just looking at each marker and trying to supplement for highs or lows, but how does it relate to the clinical presentation of your patient? That's absolutely the key and is a fundamental part of the advanced OAT mastery course. The organic acid test is a very important test to learn how to use. It'll transform your practice and it'll transform the lives of patients you're working with when you learn how to use it at an advanced level. The organic acid test also allows us to segue into other testing, whether it's chemical testing, mold testing, etc., that certain markers on the OAT provides to us. And so that's also discussed in depth in the advanced OAT mastery course. So for more information about the course, you can go to advancedoatmasterycourse.com. If you have any questions, you can email to advancedoatmasterycourse@gmail.com. You can also access this complimentary special report book by texting the word OAT on your cell phone to 66866. So OAT, OAT to 66866. You'll get sent a link to download this book. Again, I'm Dr. Curt Waller for the Advanced OAT Mastery course. Thank you.